Hey everyone, welcome back for another deep dive. When we were planning this one out, this topic really caught my eye. Kidney stones. It just seems so, I don't know, almost random, right? But you dug up some stats that blew my mind. Like, did you know that 1 in 11 people globally deal with this?
It's pretty incredible, isn't it? And just to be clear, we're not talking about actual pebbles bouncing around in there.
Well, some of the descriptions I've heard, it kind of feels that way, I bet.
I can only imagine. But really, kidney stones are these hard deposits, minerals, salts, all that fun stuff that build up in your kidneys. And most often, the culprit is calcium oxalate. But don't worry, we'll get to the food list later. And trust me, there are some surprising villains in there, my friend.
Oh, I'm intrigued. Dietary villains, I like that. Sounds like a comic book for healthy eating. But before we get to the food fight, gotta ask the question everyone's thinking. The pain. I mean, everyone I know who's had kidney stones says it's like the worst pain ever.
Yeah, it's definitely got a reputation for a reason. And it makes sense when you think about it, right? You've got these stones, some bigger than others, trying to make their way through a pretty tiny space.
You're talking about those ureters, right? Those tubes connecting the kidneys to the bladder.
Exactly. Imagine trying to squeeze, I don't know, a grain of rice through a drinking straw.
Okay. Ouch. Yeah, I'm suddenly feeling very sympathetic to those ureters. So we've got the sharp, stabbing pain, often radiating down to the lower abdomen, the groin, all that fun stuff. But pain isn't the only thing to watch out for, right?
Definitely not. You want to pay attention to any changes in your urine. Cloudiness, strong odor, even blood could be signs of a problem. And if you get fever, chills along with any of this. Could be an infection, time to get to a doctor ASAP.
So pay attention to what your body's telling you. Now, I think everyone kind of knows dehydration is bad news in this scenario, but there's more to the story than just chugging water all day, right?
Yeah. Absolutely. Hydration is super important, no doubt, but it's not the whole picture. One thing that often surprises people is the role of genetics.
Oh, so even if you're super diligent about water, if kidney stones run in your family, you might be predisposed.
Exactly. You can be doing everything right and still be at higher risk. And then you've got other underlying conditions that can play a role too.
Like what?
Well, gout is a big one. Frequent UTIs. Even things like obesity and diabetes can change the makeup of your urine, make stones more likely.
So many factors at play. This is way more complex than I initially thought.
It really is. And then, get this, even some medications can contribute.
Wait, really? Like what?
Well, some of those calcium-based antacids, the ones people pop for heartburn,
Yeah.
those can actually increase your risk.
Wow, that's a curveball I didn't see coming.
It is. That's why, talking to your doctor about your medical history, any meds you're on, super important, especially if you're worried about this.
Good reminder to be proactive, not just reacting when something goes wrong. But okay, I'm still hanging on that diet cliffhanger. You mentioned spinach before. Should I cancel my salad subscription?
Not necessarily. It's more about understanding which foods are high in oxalates. That's the compound that loves to team up with calcium and cause trouble.
Okay, so spinach is on the list. What else?
Well, nuts, especially almonds, peanuts, some seeds like sesame, sunflower.
Okay, so I gotta watch my snacks.
Yeah.
Anything else?
This one might be hard to hear, but chocolate's up there too.
No, not the chocolate.
I know. But it's not all doom and gloom. The key here is moderation and, honestly, understanding how these things interact in your body.
All right, well, you've definitely piqued my curiosity. So it's
Yeah.
not just about what we eat, but also how our bodies process all these things. Tell me more.
Well, for example, did you know that too much salt and animal protein can also be a problem?
Really? How so?
Well, salt can actually make your body excrete more calcium in your urine,
Yeah.
which, as we know,
Can lead to those calcium oxalate stones.
exactly. And too much animal protein, especially red meat, can do a number on your kidneys too.
Wow, this is way more complicated than just drinking enough water, which, by the way, we haven't even gotten into the specifics of yet.
Oh, we're just getting started. There's a whole lot more to unpack here.
Well, before we get totally overwhelmed, how about we take a quick break and come back to dive deeper into the world of prevention? We'll be right back. Okay, we're back and ready to tackle this whole prevention thing. Before the break, we were talking about how much water to drink, but it's more than just hitting a certain number of liters a day, right?
Yeah, it's more about how you drink it, really. Think of it like watering a plant. You wouldn't just dump the whole watering can on it at once, right?
Definitely not. Steady sips throughout the day, right?
Yeah.
Just like with our kidneys.
Exactly. You want that consistent hydration, keeping your urine diluted, flowing freely. That's what makes it harder for those minerals to stick together and form stones.
Makes sense. And, going back to those ureters for a second, I'm still kind of stuck on how tiny those tubes are. You said it's like squeezing rice through a straw, but do you have any other comparisons? I'm trying to really picture this.
Hmm. Let's see. Well, they're about, 3 to 4 millimeters wide.
And
So think
that's...
about like the thickness of a credit card.
Oh, wow.
Yeah, so even small stones can cause a lot of trouble when they try to pass through there.
No kidding. It's a good thing we're diving deep into all this prevention stuff then, right?
Absolutely. Knowledge is power, like they say. And speaking of knowledge, we've touched on some of the common risk factors, but I think it's worth highlighting some of the less obvious ones, too. Things that might surprise people.
Ooh, I like a good surprise. What you got?
Well, one that often catches people off guard is the connection between certain medical conditions and kidney stones.
Really? Like what, for example?
Well, for instance, gout, that type of arthritis.
Yeah.
That can actually increase your risk of uric acid stones.
So gout isn't just about joint pain. It can have those kidney implications, too. It's fascinating how all these things connect, isn't it?
It really is. It's all interconnected, that's for sure. And another one, recurrent UTIs, those can increase the risk of certain types of kidney stones, too, particularly struvite stones.
So it's almost a vicious cycle. UTIs can lead to stones, and then stones can lead to more UTIs.
Exactly. It's really important to address those underlying issues to, break that cycle.
That makes a lot of sense. And, while we're talking about these connections, what about the gut? Does gut health play any role here?
Actually, yeah. Even certain digestive disorders like inflammatory bowel disease or Crohn's disease can increase the risk.
Wow, I would not have thought about that.
It's surprising, right? It just shows how everything's connected in the body, and you got to look at the whole picture.
Speaking of the whole picture, what about diet? We've talked about it broadly, but let's break it down, the specifics of what to eat, what to watch out for.
All right, let's get into the nitty-gritty. So oxalates, those are the compounds we talked about that contribute to those calcium oxalate stones. And, spinach, we've mentioned that a few times.
Yeah, definitely got that one down.
But other leafy greens can be high in oxalates too, like beet greens, Swiss chard.
Okay, so it's not just about giving up my spinach smoothies then.
Right. It's about moderation and variety.
So leafy greens in moderation, got it. What else?
Nuts, especially almonds and peanuts, and then some seeds like sesame seeds, sunflower seeds.
Okay, so got to watch my trail mix there.
Right. And this one's tough for a lot of people.
Uh-oh, don't tell me.
Chocolate's on the list too.
You're kidding. All right, fine. So we're watching the leafy greens, nuts, chocolate. But is it like a total ban?
No, not a total ban. Just, be aware of how much you're having. And actually, did you know that the way you cook things can affect oxalate levels too?
Really?
Yeah, like boiling vegetables can help reduce the oxalate content because some of it leaches out into the water.
So if I blanch my spinach before I put it in my salad, for example?
Yeah, that's a good strategy. Steaming is another good option.
Okay, noted. So steaming, boiling over sautéing, roasting, got it. What about, we talked about salt and animal protein too. What's the deal with those?
Right, well, a high salt diet, that can increase the amount of calcium your body excretes in urine, which, as we know...
Bad news for those calcium oxalate stones.
Exactly. So you want to be mindful of your salt intake, not just the salt shaker on the table, but, all the hidden sodium in processed foods and restaurant meals.
Read those labels, folks.
Exactly. And as for animal protein, especially red meat, that can also increase your risk.
So what are some good alternatives?
Well, there are plenty. You can try leaner protein sources like fish, chicken, beans. There are so many options out there.
Okay, so we're being mindful of salt, red meat, but, earlier you mentioned something that really surprised me. You said that not getting enough calcium can actually be bad when it comes to kidney stones.
Yeah, that one throws a lot of people off. It's a common misconception that calcium is the enemy here. But actually, calcium plays a really important role. It binds to oxalate in your gut, preventing it from being absorbed into your bloodstream.
So it's like, I don't know, calcium's like the bouncer at the club, keeping oxalate out of the bloodstream party.
Uh-huh. That's a good analogy. So instead of fearing calcium, make sure you're getting enough. Dairy products, leafy greens, in moderation, of course, fortified foods.
Got it. Okay, so we've covered diet in detail, but now I'm curious about the, I guess the mental and emotional side of things. I imagine dealing with kidney stones can be pretty stressful.
Oh, absolutely. The pain, the uncertainty, all of that can really take a toll on your mental well-being.
Yeah, it makes sense. So what can people do to cope with that side of things?
Well, first of all, it's important to acknowledge those feelings, right? Don't bottle them up. And if you need help, don't hesitate to reach out. Talk to a therapist, a counselor, someone you trust. There are resources out there to help you through those tough times.
Great advice. It's so important to remember that health isn't just about our physical bodies. It's about our minds and emotions, too. And sometimes we need a little extra support to navigate those challenges.
Okay, so we talked about how to prevent those stones from forming in the first place. But what happens when, despite our best efforts, those pesky stones decide to show up anyway? How do doctors actually go about diagnosing kidney stones?
Good question. Well, the diagnostic process usually starts with a good old-fashioned medical history and physical exam. The doctor will ask about your symptoms, any past medical history, family history of kidney stones, things like that. And then they'll move on to some tests.
What kind of tests are we talking about?
Well, urinalysis is a common one. That's where they analyze your urine to look for things like blood, which can be a sign of stones, as well as signs of infection. And then there are imaging tests.
Like what?
Well, there are a few different options. A CT scan is often the first choice. It gives a really detailed picture of your kidneys, ureters, bladder, so they can see exactly where the stone is, how big it is, and all that. So it's like a roadmap of the urinary tract. But what about those situations where a CT scan isn't the best option? I've heard that ultrasound is often preferred for pregnant women, for example.
You're right. Ultrasound is a great alternative in those situations because it doesn't use radiation.
So it's a safer option for those who might be more sensitive to radiation exposure. But does it provide the same level of detail as a CT scan?
It depends. Ultrasound is really good at visualizing larger stones and blockages in the urinary tract, but it might not be as good at picking up those tiny, tiny stones.
Okay, so each imaging technique has its strengths and weaknesses, and the best choice really depends on the individual situation.
Exactly. And in some cases, a doctor might even use a combination of imaging tests to get a complete picture.
Makes sense. So it's like putting together a puzzle, using different pieces of information to create a full understanding of what's going on.
That's a great analogy. And in addition to imaging tests, blood tests are often part of the diagnostic process too. They can check for things like elevated levels of calcium or uric acid, which can be signs of kidney stone formation.
So it's a pretty comprehensive approach. Doctors are looking at the immediate problem, the stones themselves, but also trying to figure out what might be causing them in the first place.
Precisely. It's about taking a holistic view, considering all the factors that might be at play.
That makes a lot of sense. Now, I know we've talked about prevention, diagnosis, but I'm also curious about treatment. What happens once those pesky stones have been identified? What are the treatment options?
Well, the good news is that not all kidney stones require invasive procedures. Often, we can take a more conservative approach, especially if the stones are small and likely to pass on their own.
Okay, so what does that conservative approach entail?
It usually involves a combination of pain management, increased fluid intake, and sometimes medication to help relax the urinary tract and make it easier for those stones to pass.
So it's like giving your body a little extra support to do what it needs to do naturally.
Exactly. But there are times, of course, when conservative management isn't enough, especially if the stones are large, causing a blockage, or leading to complications like an infection. In those cases, we might need to consider some of the procedures we talked about earlier.
Right, those procedures that sound a little bit more intense.
Yeah, they can sound a bit scary, but it's important to remember that they're usually very safe and effective. And thanks to advancements in medical technology, many of them are minimally invasive, meaning they involve smaller incisions and faster recovery times.
That's good to know. Okay, well, I think we've covered a lot of ground here today. We've explored the causes, symptoms, diagnosis, and even some of the treatment options for kidney stones. But I'm curious, are there any final thoughts or words of advice you'd like to share with our listeners before we wrap up?
Absolutely. If there's one thing I want everyone to take away from our deep dive today, it's this. Don't be afraid to advocate for your own health. If you're experiencing any symptoms that concern you, or if you have any questions or concerns about your kidney health, don't hesitate to reach out to your doctor. They're there to help you navigate these challenges and find the best course of action for your individual needs.
That's such an important message. It's about being proactive, informed, and empowered when it comes to our health. Well, it's been a truly fascinating journey exploring the world of kidney stones, wouldn't you say?
I completely agree. It's been a pleasure sharing this information with you and our listeners.
Thank you so much for joining us on this deep dive. We hope you found it informative and helpful. And as always, remember to stay curious and keep exploring the fascinating world of health and wellness. We'll see you next time on the deep dive. All right, we're back for the final part of our deep dive into kidney stones. And, after all this talk about prevention and early intervention, I'm thinking about folks who might be listening, maybe a little worried, what if this happens to me? What would you say to someone who's feeling a bit anxious about their kidney health?
Well, I'd say, first of all, it's great that you're tuning in and being proactive about your health. That's already a step in the right direction. And, it's understandable to feel a little apprehensive, especially when we're talking about something that can be as painful and disruptive as kidney stones.
Yeah, I mean, just hearing about those stones trying to pass through those tiny ureters is enough to make anyone swarm a bit.
Exactly. But the good news is, the more we understand about kidney stones, what causes them, the warning signs, the treatment options, the less power those anxieties have over us, right?
That's so true. Knowledge is power, like they say.
It really is. So if you're feeling anxious, my advice would be keep learning, keep asking questions, and most importantly, don't hesitate to reach out to your doctor if you have any concerns at all.
Great advice. And speaking of taking action, let's talk about those situations where, despite our best efforts, prevention doesn't quite cut it and those pesky stones decide to show up anyway. We've covered a lot of ground already when it comes to the less invasive treatments, but what about those times when a more hands-on approach is needed?
You're right, there are times when those conservative measures just aren't enough. And for those more challenging cases, there are procedures that can help. For example, when we're dealing with larger or more complex stones that don't respond to other treatments, there's a procedure called percutaneous nephrolithotomy, or PCNL for short.
That's the one where they make a small incision in the back to access the kidney directly, right?
Exactly. It sounds a bit intimidating, but it's actually a very effective and safe procedure, especially when performed by an experienced surgeon.
Can you walk me through how it works?
Sure. So basically, a thin tube, called a nephroscope, is inserted through that small incision in the back and into the kidney. Then the surgeon can use tiny instruments, passed through the nephroscope, to either remove the stone in its entirety or break it up into smaller, more manageable pieces that could be removed more easily.
It's incredible what surgeons can do these days. What's the recovery like for someone who's had a PCNL procedure?
You would typically stay in the hospital for a few days after the procedure, and you might have a small tube, called a nephrostomy tube, temporarily put in place to help drain urine from the kidney. But the good news is, most people make a full recovery and are back to their normal activities within a few weeks.
That's reassuring to hear. But out of curiosity, is open surgery ever still used for kidney stones? It seems like with all the advancements in minimally invasive techniques, it wouldn't be necessary very often.
You're absolutely right. Open surgery for kidney stones is incredibly rare these days. It's reserved for those very complex cases where other options just haven't been successful or aren't feasible for some reason.
Well, that's good to know. It sounds like even in those more challenging situations, there are effective treatments available.
Exactly. And, with advancements in technology and surgical techniques, even those more complex procedures are becoming safer and less invasive all the time.
That's definitely encouraging to hear. But before we wrap up our deep dive today, I wanted to circle back to prevention one last time. We've talked about a lot of different strategies, but are there any final pearls of wisdom you'd like to share with our listeners?
Absolutely. If I could leave everyone with one final thought, it would be this. Be proactive about your kidney health, especially if you've had kidney stones before. This might mean having regular checkups with your doctor, maybe some periodic blood and urine tests, or even imaging studies, just to keep an eye on things and catch any potential problems early on.
So it's about staying vigilant and taking those preventive steps to, keep those pesky stones from making an unwelcome comeback.
Yeah.
Well, I think we've covered just about everything there is to know about kidney stones, from those microscopic crystals all the way through to some of the more advanced treatments available today. It's been a truly fascinating deep dive, wouldn't you say?
I agree. It's been a pleasure sharing this information and hopefully empowering our listeners to take charge of their kidney health.
And that's what it's all about. A huge thank you to you for joining us today and sharing your expertise. And to our amazing listeners, thank you for tuning in and being a part of this deep dive into the world of kidney stones. We hope you found it informative, insightful, and maybe even a little bit empowering. Remember, knowledge is the first step towards a healthier, happier you. Stay curious, and we'll see you next time on The Deep Dive.